How can you improve your circulation? Guys, we are talking about this because I did a video on the signs of poor circulation, in particular, signs of peripheral artery disease. I want you to make sure you take a look at that video because that's going to lay a lot of groundwork for this video. You guys asked for a follow-up on how to improve circulation, so here we go. By the way, peripheral artery disease, if you guys are just jumping in now, is when the peripheral arteries, that is the arteries like in our arms and our legs, usually our legs, they become narrowed or blocked due to plaque or plaque buildup. What that does is it does not allow oxygen-rich blood to travel through those arteries and get to our body the way it should, and we can develop a number of symptoms. Again, take a look at that first video. So many of you guys asked, how can I improve a circulation and make sure my circulation is good? What we're going to do in this video, I'm going to tell you the risk factors for peripheral artery disease, the things that predispose you to it. I'm also going to talk about ways to sort of help improve symptoms and may be good for prevention as well, and then also some other treatments for peripheral artery disease. All right, so risk factors for getting this peripheral artery disease are some of the following things. Number one, smoking. Probably the biggest risk factor, certainly one of the biggest. If you smoke, you need to quit. I'll say that again, but smoking is a huge risk factor for poor circulation, and namely peripheral artery disease. Keep that in mind. Also another risk factor, or these are things that may increase your risk of having poor circulation. Blood pressure, especially blood pressure that's uncontrolled, okay? Diabetes, in particular diabetes uncontrolled, and high cholesterol as well. Those three things, that sort of trifecta, can put you at risk for peripheral artery disease. Also, older age older than 60, but may not even be 60, but older age in general, that is a risk factor for this sort of narrowing of the arteries that can cause poor circulation, especially in your legs, sometimes your upper extremities too. And then, of course, atherosclerosis, that's sort of artery disease. You know, remember, when we have blocked arteries in our lower extremities, our legs or our arms, oftentimes that's an indicator that we may have blocked arteries in other places. Okay, and that's not a good thing because a blocked artery in the heart is a major problem. It's a heart attack, right? And same thing with the brain, that can be a stroke. So we want to be very, very careful about blocked arteries. That is one of the main tenets here. By the way, I didn't introduce myself. I just jumped right in because I'm so excited to talk about this topic. I'm Dr. Jen Caudle, practicing family physician. It's great to be here. Okay, so those are the risk factors, meaning those people with those conditions are at higher risk for developing poor circulation. Okay, the smoking, blood pressure, diabetes, high blood pressure, diabetes, high cholesterol, older age, people who already have blocked arteries in other places. Okay, so now you're saying, well, how can I say improve my circulation if I may have some of this peripheral artery disease? And I would even go so far as to say, how can I maybe keep this from happening or slow the occurrence of this happening? So that's the name of the game of this video. And a lot of the answers have to do with the risk factors I mentioned. So first thing is exercise, okay? Even if you're nowhere near the risk factors that I mentioned, even if you don't have high blood pressure, cholesterol, etc., you're not an older age, etc., you don't smoke, a good way to keep your blood vessels healthy is to exercise, okay? That is a good general, and by the way, exercise helps a lot of things, not just blood vessel health. So making sure that you're exercising is very important. Also, not smoking. We know that smoking is a strong risk factor for peripheral artery disease. Do not smoke. And you know what? If you do, quit. Consider quitting. And by the way, there is no shame in this game. Quitting smoking literally can be one of the hardest things, and often is one of the hardest things my patients ever have to do. It is so difficult. So do not shame yourself if you've tried multiple times, if you've not been ready yet, etc. Just keep trying. Just keep giving yourself the chance, okay? Just, hang in there for yourself, show up for yourself. The next thing is ways to sort of keep your circulation healthy, to try to slow down the progression of peripheral artery disease or narrowed arteries, poor circulation. Make sure you're eating a healthy diet. So a diet that I love is the Mediterranean diet. I have videos on the Mediterranean diet. I'll make sure I link them here. Super important. Also, a low salt diet that helps with blood pressure, keeping getting a healthy blood pressure, there's a diet called the DASH diet that is really, really excellent with that. And I'll link that to this video as well. Super. And by the way, if you're watching this video on like Facebook or something and you don't see the links, DM me, I'll send you the videos. But a healthy diet, so, so important, okay? Those are two great ones. The next thing is keeping your blood pressure controlled, okay? So this is another reason why, you know, if you have been told that you have high blood pressure, but maybe you have been not wanted to get treated, maybe you've not wanted to take medications or what have you, but you've also not been able to get your blood pressure down, this is another reason why, you know, following your doctor's advice and maintaining a normal blood pressure is very important. Remember, you're not necessarily going to feel, most people don't feel when their blood pressure is high. That's not a reason not to treat it, because it can cause so many other problems. One of them is it can lead and be a risk factor to poor circulation, okay? Again, that's where it's all sort of tied into one another. It's also another reason why we doctors in the office tend to make a big deal out of all of this stuff, because we know that all of these things are linked and sometimes they can just add on. So poor circulation to prevent, to sort of lower the risk of progressing to having poor circulation, keep your blood pressure under control, follow your doctor's advice. Also diabetes, okay? You know, and cholesterol, diabetes and cholesterol. You say, well, I feel fine. I don't want to take a statin. I don't want to take a this or that. There's a bigger picture I need you to be looking at. And that's what we doctors are looking at. It's not necessarily about the medicine. It's not that we want you to take pills. What we want is for your risk factors for so many things, whether it's heart attacks, strokes, etc., peripheral artery disease, poor circulation. We want you to not have these things. And treating your diabetes, your cholesterol, your blood pressure is a huge step in keeping you from having these other problems down the line. So I hope this is making sense too. I have videos on, you know, statins and diabetes medications. There's a lot of myths running around about statins and metformin and things like that. I just want to make sure that you are informed and you understand what the real deal is. So make sure you take a look at those. But please, you know, hear your doctor out when they are talking about treating these elements, because poor circulation can be a downstream effect of these things: blood pressure, cholesterol, diabetes, not being treated, okay? So those are some of the main ways that we lower our risk of progression of poor circulation, that lowers our risk of having poor circulation, lowers our risk of getting to the point where we've got peripheral artery disease, etc. Now, if you have peripheral artery disease, meaning you've been diagnosed, and by the way, there are tests that your doctor can do. Take a look again at my other video to see what the symptoms are, to see if you need to ask your doctor about it, okay? That's not the purpose of this video, but your doctor can test you if you have it, to see if you have it. If you do have narrowed arteries in your periphery, your legs, perhaps your arms, there are what we call interventions or treatments that can be done to help keep your arteries from continuing to get more narrowed and to keep your circulation from getting worse. I'll briefly mention these. These are things like statin medications, antiplatelet drugs, whether it's an aspirin or something else. Vasodilators sometimes are used, blood pressure medications, diabetes medications if you're diabetic, and sometimes, and in some cases, surgery is needed, okay? But I hope this is helpful, guys. Let me know what you think in the comments. Share this video with someone else you think could benefit from it. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on everything. On Facebook, please like and follow my page. For those of you on Facebook who send stars, thank you in advance. YouTube, please subscribe to my channel. Click the little bell for updates. Also, join my subscription groups in both places, Facebook and YouTube. I'm also on WhatsApp, TikTok, Threads, Instagram, at Dr. Jen Caudle. Make sure you follow me. And go to my website, drjencaudle.com, to sign up for my free health newsletter. Guys, I love you.